So, good day, ma'am. So, today I will go to assess the seizure precaution. But first, I need to introduce myself. My name is Angel Esteban, student nursing from OFPCC. I'm student nurse for today. So, my name is Angeli and you are?
Chelsea.
So, I need to explain the procedure and provide for privacy by closing the door and closing the curtain. And first of all, the assessment of the risk that the patient will have a seizure during the hospitalization requires a thorough and observation of certain risk factors like diagnosis of seizure disorder. Next is frequent seizure activity and any seizure during the past year. Ma'am, meron po ba kayong seizure this past year? Okay. Then, history of head trauma including surgery within the past 3 years. Meron po ba in past 3 years? Okay. And then, treatment with medication that lower the seizure. Resort all or antidepressant and antipsychotic drugs. Meron po ba kayong mga iniinom na gamot? And withdrawal and anti-epileptic medication for evaluation of a seizure disorder and readjustment of medication regimen. And next po, any seizure activity within the past 12 months. Ma'am, meron po ba kayong, nag-seizure po ba kayo with this past 12 months? Okay. And second po, there must be care plan to set up the environment to prevent injury. Maintain continuous observation to know when a seizure is starting to be able to get the patient within a few seconds of onset. And thus when the seizure precautions are warranted, any of the above that the risk factor that care plan must include the following. First is make certain that the patient has the following equipment like oxygen nasal cannula and tubing, and oxygen flow meter, suction gauge, and suction canister, and last is suction tubing to connect the canister. Then I assume that I already have all that equipment. And second is assign the patient to room in close proximity to the nurse station. And maintain continuous observation and maintain assembled equipment, suction equipment in room. And maintain assembled oxygen equipment at bedside. And pad side rails to bed. And keep bed in the position with all side rails and up all times. And next is keep unnecessary equipment out of the patient's room and instruct the patient not to get out of bed without assistance. And next is assure that cold bed is always within the patient's reach and make sure that the family knows where it is and how to use it. And avoid use of restraints and obtain one-to-one care provided if the patient is unable to follow instruction to maintain safety. And next is check vital signs every 15 minutes and maintain airway patency during the post-ictal phase or period of time immediately following the seizures during which the patient remains comatose or is euphoric. And finally, it is imperative that the nurse focus on observation and response, being at risk of having a grand mal seizure. While unattended is extremely dangerous because of the potential of catastrophic injury and or choking, and within this risk of is identified or should be identified. The nurses owe duty to know whenever there is an onset of seizure and be in attendance during the clonic, wild uncontrolled movements, and clamping of the jaw and post-ictal phases.